now we can talk about what gets paid for by insurers. Given that jaw surgery, of course, you're paying for a lot more than just the surgery. There are a lot of other elements, and so we thought it would be useful to run through this for patients. Cool. So here we've just listed out every conceivable part of jaw surgery treatment. So first of all, the main thing is the surgeon's fee, paying for the surgeon's time in the OR. So this is covered by medical insurance, but as we mentioned before and harped on, that like very low out of network allowable amount that causes out of network costs to balloon. This comes from the surgeon's fee. Because typically we see this quite commonly, where someone will have an out-of-network surgeon, but the out-of-network surgeon is able to go to a nearby hospital. So the operating room and the anesthesiologists are in network. But again, that surgeon is very expensive, and so you still see tens of thousands of dollars in cost there. Uh, so running right along through these, so the additional fees, like anesthesia, OR, those are covered by medical insurance, but ensure that your facility is in network. That this should be pretty easy information to find from your insurer. Overnight hospital stay. Many, in fact, most surgeons require this for orthodontic surgery, sometimes even more. It is covered by medical insurance. Just make sure that you choose an in-network facility to stay at. And again, if you don't have insurance coverage at all, like if you have not convinced your insurer that this is medically necessary, this overnight hospital stay is where costs can really balloon to like astronomical levels. This is where you see a lot of the like $100,000 jaw surgeries, and so again, be very careful of that. Consultations, of course, a lot cheaper than the actual surgery, but these are hundreds of dollars, so worth discussing. Those are covered by medical insurance, along with a copay, and then and consider whether your insurer requires referrals if the physician offers virtual consults, that kind of thing. Then lastly, their orthodontic treatment, which as we mentioned earlier, is considered dental rather than medical. And you can look into your dental plan, but typically coverage for orthodontic treatment is not great, and you're probably going to pay a good majority of the cost out of pocket.
How does that usually play out if someone goes in and has a jaw surgery and doesn't do their homework ahead of time and ends up with a six-figure bill that they can't afford? What do they do?
It's a tough situation, and one that we really hope to absolutely minimize the number of people that end up in that situation. So that is a little bit outside of our expertise, given that we usually work with the insurer to get coverage in the first place. However, there are, and Haley and Malcolm, you can add to this, but I know that there are certain debt forgiveness programs. You might be able to qualify for what health systems will call charity care, depending on your income. There are medical bill negotiation services. There are, there are a variety of things like that. But again, like it's really not a situation that one wants to be in.
Yeah, yeah,
Yeah, just, oh, sorry, go ahead, Ron.
I was going to say I could see that getting ugly. Potentially, you getting collection calls for the next 10 years, your credit score getting dinged, and this thing just weighing on you for years and years to come after that.
Yeah, I think the insurance world, as you can see from this slide deck that we tried to make as simple as possible and is still incredibly complicated, it just goes to show just how non-transparent it is. And how complex it is. So like patient education is really key. And, it's great that you put on episodes like this, because I think it's important. Again, one of the main things we want people to take away is look into this stuff in advance. Check ahead of your surgery. Make sure everything is buttoned up, including surgeon fees and hospital fees. And as Alex was saying, there are a lot of people still, unfortunately, who think they can trust their insurance when they get their approval letter, have their surgery, afterwards end up with these crazy costs. There's charity care. Lots of people don't know you actually can negotiate your bills. A lot of these super specialized surgeons are maybe not going to want to do that. but it's always worth asking. For your scenario, you can explain to them what happened. You can and try to work with them, see if they're willing to negotiate. There are also a lot of like nonprofit organizations that will help you basically. And again, it kind of depends on your situation, but hopefully you don't end up in that situation and you have learned ahead of time about how you should check into this in advance. But a lot of people don't know that. So if you do end up in that situation, there's still options, but it's likely not going to be fighting with the insurer. If you talk ahead of time, you can work with trying to get the insurer to play ball. If you wait until after the surgery, we can try for post-service coverage. It's just a lot harder. And then you have to go through some other avenues to try to get other folks to help with the funding.
Right. In negotiation.
I was just going to add one little brief caveat to what Haley mentioned. All of that was 100% correct. You mentioned negotiating with the surgeon on the surgeon's fee. The bill that you get from the hospital and the facility is actually separate than that, and you can also potentially negotiate that as well. Just one little thing to add. Yeah.
Cool. That's exactly what I was going to ask. If negotiation only applied to surgeon's fees, or if it applied to hospital fees potentially as well.
Yeah, potentially even more with the hospital. Like there's, I don't know if we've done this enough times to really say for certain that this is the case. But if you think about it, usually these hospitals are these massive financial institutions. So they typically do tend to have more like charity care or more services in place to help people who can't pay for their coverage. So definitely worth negotiating with all the different stakeholders and seeing what they're willing to do.
Yeah. They'll just take the tax write-off.
Very lucrative. Cool. We can move on. This is again just continuing the list from before. Genioplasty. So, as many viewers I am sure are aware, this is moving the chin forward in addition to the double jaw surgery. This is typically not covered and considered cosmetic, although I've heard of a few isolated cases where it was able to get covered. And so, it might be worth a shot, but I would go in for patients with the expectation that if you are getting a genioplasty, you will pay for that out of pocket. Rhinoplasty can occasionally be done concurrently with jaw surgery. This is typically considered cosmetic by insurers. There might be some edge cases against that when there's been some trauma, or this can be considered more like on the reconstructive end of plastic surgery rather than the more cosmetic aesthetic end. But it's very much an uphill battle, although as a portion of a rhinoplasty, you can get a septoplasty or correction of the deviated septum covered if that is part of the game. Post-operative therapy, so things like physical therapy, speech, myofunctional, yes, that can be covered. You would need it prescribed by your physician, and there might be some kind of limits on that from your insurance plan. Of course, definitely worth checking out. Home care and recovery supplies. This is a complicated one, but typically prescription items can be covered. Over-the-counter items usually can't, although you can use some kind of health savings account, something like that. It gets pretty complicated, but honestly, at this point, patients usually aren't too worried about it because jaw surgery is like so costly that what is an extra few $100? And then the tests or labs for surgery readiness. Surgeons will often require this just to make sure you're healthy and ready to undergo what is a major surgery. And those are very, very often covered. In fact, that is the one item where even if you have no medical necessity whatsoever, it might be that those blood tests are covered anyway. So that'll save you, $100 off of your $100,000 bill.
Mm-hmm. Great.
Yeah, I know. Wonderful, wonderful news.